Welcome back to our sequence of sex, female health, and contraception. So this is part 2 where we'll discuss the female reproductive health, and again with Dr. Ndwiga. Yes, so we have the female reproductive health. You know, a lot of people think like the vagina is supposed to smell like flour. It's supposed to act in some type of way. They're supposed to wash it like they're washing, you know, the feet, scrub it, use soap, you know. Yeah, so we want to talk about majorly the how to clean it, how it's supposed to be. Yes. So you find some people like going to douching, using some perfumes, some soaps. They use different products down there, and we all know it's a self-cleansing organ. Yes.
Yeah, so the vagina, just like the eye, has a self-cleansing mechanism. Yes. Which means there's absolutely no need to clean the vagina because it does that itself. Okay. I've actually had patients who come up to me and say that they had poured yogurt on their vagina, which is like super scary to even imagine that people could be putting some things in the vagina. There are those that use garlic and ginger, which of course is not advisable at all. Yes. Because you risk changing the pH of the vagina, which could lead to other things. Yes. So generally, the vagina has bacteria called lactobacilli, which maintain a slightly acidic pH, which helps the vagina to stay healthy and and fight infections. Yes. Yeah. So yeah.
Yeah. So when you're saying like it's a self-cleansing, so by the vagina you mean like, you know, we all know the vagina is like the passageway, but kuna mwenye tadhani like, so the whole thing like they won't even clean it, wanasema watatumia maji. So I thought like, so there's the upper part, the labia.
The vulva, the labia. Yeah, generally by the vagina I mean the canal. The canal from the vulva towards now the cervix. That should not be cleaned at all. For the labia, the lips of the vagina, you can actually clean. It's recommended to just use water. You can also use a little bit of soap if it's unmedicated and unscented. So basic bar soap does wonders. Just apply on the lips and rinse it off with clean water. And that's all you need to do. But as for the inside of the vagina, you should not introduce anything there. Because the inside of the vagina has its own pH, its own internal environment, which should not be altered at all. So things like douching are not advisable. There are people who douche with sodas, kama Coca-Cola,
Why?
in an attempt to like restore, I don't know, to wash off. But it's not recommendable at all because you risk changing the pH.
And pardon, a question on the washing. So there's the lips. You can use soap, a little bit of soap. But you know, after the lips, you know, there's that direct opening to apple. You know, like there's some people who are sweaty. There's some people who don't shave. They just prefer hair down there. You know, like of course it's just a body part. Like anyway, we don't sweat the armpits. See, there's also that cleaning that's supposed to happen down there. Can you use soap like the immediate opening, or it's just water?
Just water. Just water. You can run your fingers a little bit. But generally just water. You can use soap for just the outside. You have two types of lips. You have the labia majora, which are the big fleshy lips on the outside, and now you have the thinner lips, the labia minora. So you can apply. Of course, when you're showering, there's soap that runs down there. So you can actually, you don't need to like use more soap. You can just use that and just clean with your fingers around the area. Just clean around the area and rinse with water. But as for the entrance or near the entrance, just water. Just water, plain water. As for the vagina itself, the pathway, no, nothing.
You let it clean itself.
Just let it clean itself, and and that will ensure that the vagina stays the way it should be.
You know, also there's a lot of videos on, you know, like feminine hygiene is really, yeah, people just want to look into it because people want to smell like roses down there. So you find some videos, some ladies say like cleaning it with cold water makes a difference, cleaning it with hot water makes a difference. Does it make any difference cleaning it down there?
Usually the temperature of water is not really an issue because temperature does not change any property of water. It's still water. You can actually use a salt bath for the vagina, which is totally okay. Actually, women after delivery are advised to like sit in a salt bath to help heal the wound, the episiotomy scar. So yeah, so a temperature of water does not really make a difference. You can try slightly salty water, which will help to kill germs. Plus, it does not change the pH of the vagina. Yeah.
Okay, and you've said about the douching.
Yeah.
You know, like some who do it like once in a while when they go, like, you know, the women with the self-care day. So when they go for the waxing, they decide to do other things down there. So even once in a while, it's not advisable.
If you're just douching with water, then that's okay. If it's once in a while, you can actually douche after sex with just water. You can even run a finger up there while you're pouring water, rinsing, and washing off the semen and the secretions. Yeah, but definitely no medicated stuff, no perfumed stuff, no yogurt, no garlic, ginger. Those things do not belong in the vagina. So they shouldn't go there.
So it's just marketing when they say like it's safe for the vagina.
Yeah, it's just a marketing gimmick to make you guys buy products that you don't need.
Okay, so no perfume, no nothing.
No perfume, no nothing. The vagina has its own smell, which actually a very interesting observation is that some vaginas do not have a smell at all. Yeah. From my own personal experience as a doctor, also as a man, some vaginas do not have any smell, but some will have a slightly tangy or musky smell. It's a sort of smell that you need to experience to know, but there's nothing wrong with normal vaginal smell. Of course, because it's acidic, so it will have a slightly tangy smell. Which is okay. So, and also the smell ranges depending on what part of your menstrual cycle you're on. So the smell might be slightly different during ovulation. It might be slightly different when you're experiencing your menses. It may smell like pennies, like coins, because of the iron that is contained in your blood when you're menstruating. So when you're menstruating, your vagina might be smelling like pennies, like coins because of the iron. Yeah, but normally, there's a normal smell which every lady should be able to tell. And then you have the abnormal smell, which normally is an indication of other things like infections.
So when we say abnormal smell, is it when you can is it okay to actually smell your vagina? Like right now I'm seated, when I smell it, is it okay, or should I do something about it?
Usually when you're clothed, you should not detect the odor of your vagina, because it's not a very potent smell that can actually be felt when you're just, seated and going about your day's activities. But when you're having an infection and the smell of the vagina changes and it's actually detectable, then that calls for attention. It calls for going to the doctor and having some tests performed and finding out why it's smelling.
So now you said like some people do not have like the vaginal odor. Okay, let's not call it odor because inakaa kitu ya kunuka. The smell that is supposed to be down there. So there is the infections that come with having a vagina, because it's a very sensitive part. So what is a normal vaginal discharge and when is it abnormal?
Okay, it's normal when it's clear or colorless. It's also normal when it's white. It's also abnormal when it's still white. Yeah, because some fungal infections like yeast will present with a white vaginal discharge.
Yes.
But generally, also during, depending on the time of your cycle,
Yes.
sometimes during ovulation you can have a white discharge, which is very normal.
Yes.
Does not mean that you're sick or anything. But discharge that smells is definitely a reason for concern.
Okay.
Because normal vaginal discharge should not have a foul smell.
A smell.
Yes. If at all it has a smell, it should just smell like your vagina.
Yes.
On normal times.
On a normal day.
Yeah. So discharge is very normal. But it's not a must that you have discharge. You might actually not be having any discharge at all, which is still normal. But in the event that you have a clear or colorless discharge or a slightly white discharge that is not foul, that only comes when you're ovulating, and does not present with other symptoms like pain on urination or lower abdominal pains, then it's also not a reason for concern.
Okay.
Yeah, and most of the time it will just tend to stay for a couple of days and then disappear.
Okay.
Yeah.
Oh, okay. So a little discharge on your panty at the end of the day, that is okay,
That's
as long as it's
fine.
the normal clear white.
Yeah, because it's part of the self-cleansing mechanism.
Okay.
Yeah, because it cleanses itself, and then the residual discharge is just discharged, and you will find it on your panties, on your thongs. Yeah.
Oh, speaking of panties and
And
thongs,
thongs,
yes. Yeah, the underwears, we also find that as a lady, you'll wear this type of underwear, then you find there's a slight difference with the functioning down there, like something has changed.
Yeah.
And we know, like most people, just go for the cotton undies because they're the most healthy. So tell us about the thongs, the less underwears, the cottons.
Yeah, so generally natural fabric is more preferred to synthetic fabric. Because cotton, for example, has holes and spaces which allow for the vagina to breathe.
Yes.
So that will actually permit aeration in the vagina, and it will actually prevent yeast from building up.
Okay.
Staying commando is also okay.
Okay.
Yeah, commando means you go without panties or thongs. That's also perfectly fine because it allows the vagina to breathe.
Yes.
Synthetic fabric like nylon, velvex, which other do you know?
Yeah. Okay. Most as ladies, they go for the less undies, and we know
Oh,
like,
the lace undies.
yes,
Yeah.
because it has the bit of polyester in it.
Yeah. Yeah, so there's also that issue of microplastics that comes with polyester, and microplastics actually change the environment of the vagina because polyester continuously sheds microplastics, including inside the vagina, and that will have an effect. If worn consistently for a long period of time, it will actually change the environment. So as much as possible, we advise natural fabric, or commando. Just go without them. If you're not about to menstruate and you know that you're okay, you can actually go commando, which is perfectly fine.
Okay, so commando with like these jeans, like it's okay. Like I'm going, let's say, out to work, then I'm in a jeans and commando. Like this is also another fabric. It has no problem.
No, actually no. Apart, if it does not like give you friction around the area, then it's perfectly fine. I've seen women who like wear jeans and go commando at the same time, which is perfectly fine. From a medical perspective, it does no harm. Maybe from a personal preferences perspective, as far as comfort is concerned, maybe jeans might be a little bit tight and cause a bit of friction around the area, in which case you can wear a cotton panty. Yeah, but generally I would advise patients commando is better than synthetic underwear. Yeah, because so it's natural fabric underwear, commando, and then synthetic.
Because personally, if I was to go commando, you know, like I'm using a public means of transport, so I'm thinking of like nimeva, maybe a jeans or some jeggings, so I'm sitting on a seat that everybody has
sat on.
Like I'm thinking like it will cause something down there because I'm just sitting, you know, like you are a female, so you get discharge.
Yeah.
So haiwezi leta any effect do, like you'll sit here, go somewhere else, sit some in the office, go into a bank, sit there?
Well, not really, because the vagina is acidic, and it's acidic for a reason.
Yes.
To kill any organisms like bacteria which may want to enter.
Okay.
The same way your stomach is acidic for a reason, to neutralize any germs that may enter through food, is the same way that your vagina is acidic. So already the vagina takes care of that itself. Yeah, unless the surfaces you're sitting on are very dirty or wet or moist. Yeah, that's when you run the risk of probably catching something. Yes. But if it's just like a matatu ride for 20 minutes and the seat you're sitting on is clean, yeah, it does no harm. Does no harm at all.
Yes.
Although natural fabric like cotton is better than Commando.
Okay.
Yeah, but yeah.
It's okay.
Yeah, it's still okay. Yeah.
Okay, so moving from that, there's this common problems, yeah, that send women to the hospital, the UTIs and the yeast infections.
Yeah.
Like you find most females struggle with them. Can you tell us the causes?
Yeah.
Yes. Is it the diet? Is it the partner? Is it my hygiene?
Yeah.
Yes.
So UTIs stand for urinary tract infections, and these are infections which will invade the urinary tract. It's very important to note the difference between the urethra and the vagina. Yes. You have two openings. Okay. You have the urethra, which is concerned with urine production. Yes. And that comes from the bladder, which comes from the kidneys. Yes. So that's a very separate system from the vagina, because from the vagina you have the cervix, the uterus and the ovaries. Okay. But now they all meet at the entrance. Yeah. Yes. So you do not pee with your vagina. Yeah. You pee with your urethra. Yeah. Yeah. So infections could affect both of these systems. Yeah. Okay. So UTIs will normally affect the urethra and the bladder and the kidneys. Yes. While the other vaginal infections, which are normally called vaginitis, will affect now the vagina, the other system, the reproductive system, and not the urinary system. Okay. Yeah. So so UTIs are normally bacterial in nature. They're caused by bacteria. It could be something as trivial as using a public washroom, which has a bacteria. Yes. And you end up getting the bacteria on the urethra. Yes. And because females will have a very short, anatomically they have a very short urethra. Yes. So it's very easy for the infection to ascend to the bladder and the kidneys. Okay. So that's a UTI. Yes. Yeah. It's important to make the distinction. While on the other hand, other infections will normally target now the vagina itself. Okay. You have the yeast, you have gonorrhea, you have chlamydia, trichomoniasis, you have bacterial vaginosis. All of these are limited to the vagina and not the urethra. Okay. Yeah. Yes. So diagnosis is usually done through a test for UTIs. We run a test, and usually we detect some things in urine which are not supposed to be in urine, like pus cells, blood cells, white blood cells in urine will indicate a urinary tract infection, which needs to be treated, because if not, it ascends all the way to the kidneys and brings further problems. Okay. Yeah, so UTIs, they are more common in females because, number one, as I've mentioned, the short urethra. Yes. Also, the close proximity of the urethra to the anus. Okay. Your anus is a haven for bacteria because of poop. Yes. Poop will have a lot of bacteria because it's basically food. It comes from your stomach. You have a lot of bacteria in your stomach, E. coli and the rest. Yes. So usually, if you're not wiping the way you should, which is from front to back. Yeah, front to back. If you're wiping now the reverse, back to front, you tend to transfer those bacteria from the anus to the urethra, and that gives rise to a UTI. Yeah. It won't give rise to a vaginal infection. It will give rise to a UTI. Okay. Yeah. So you're supposed to wipe the way you've mentioned. Yes. It's even more hygienic to clean with water and soap. Yes. after you've pooped. You can synchronize your pooping time with your showering time. You can poop and then shower, which makes it a lot more hygienic.
Okay.
Or you can do it the Muslim way, which is still okay. Yes. So it's important to make the distinction.
Yes.
Yeah.
So UTIs, you find like most ladies complain like they get the UTIs. So there is that part you've told us. Maybe she's wiping from back to front. Then there's the spouse part, like the partner.
Yeah.
You find like after several visits to the gyna, you're told like bring in your partner. We have to check him.
Yeah.
What causes like what brings about like transferring from the partner to her? Is it because you've said it's just to the urethra? It's
so in the event that the partner is involved, then that means it's not a UTI but a vaginal infection. Because, for example, if I'm a man and I'm having intercourse with several females, and from one of the females I pick a vaginal infection, something like yeast. Yeast means fungi, and fungi reproduced by spores, which are very microscopic eggs that fungi produce. And some of them will remain on my penis. So now when I go to another female and have sex with her, I will transfer the yeast into this other female, giving rise to a yeast infection in the other female.
So the partner does not give you UTI.
No, UTI.
It's the vaginal infection.
It's vaginal infections. Yeah, you cannot get UTI from another partner because UTIs are mainly urethral and bacterial in nature. But what you can get from your partner are now the other infections: gonorrhea, chlamydia, trichomoniasis, bacterial vaginosis, yeast infections, HIV, syphilis, crab lice. You can have all sorts of other infections which you can receive from your partner. But specifically for urinary tract infections, you cannot get urinary tract infections from your partner. Because those ones are limited to the urethra, and those are bacterial in nature. They are more to do with a hygiene issue and not sexual transmission.
Also, UTI, it's just a personal problem.
It's a personal problem that affects. And even men can get UTIs, although it's less common because of the long urethra. Of course, our urethra is located in the dick, so it's longer, and it takes a while before the bacteria can reach the urethra and ascend. So for men, it's more. It's not very common for a man to get a UTI compared to women because of the close proximity to the anus and also the fact that your urethra is very short.
Because of sexually active people, how long do you recommend for them to stay before getting tested for any infection down there, like the regular checkups for both of them? We know females actually do it regularly. So mostly for the men.
There's no specific timeline which you should get tested for UTIs. Although if your partner is prone to getting UTIs, it's advisable you get them maybe every month, just a urine test, a routine urine test. Just to check if there's anything wrong. But also it's also important to take extra precaution, especially as a man, to not be promiscuous because you risk endangering your partner, because she bears most of the brunt that is brought by your promiscuity. Because while you might be just a carrier of these things, she actually gets to suffer and you don't. So it's very important to take care of your partner by not engaging in promiscuity and sharing too many people and too many bodies.
Okay, then there's the diet and your reproductive health. You find some ladies when they before you get into the diet, there's the how to sweeten it down there. You find some people say like, I'll take pineapple juice, I'll eat the pineapples, there's the cranberry juice. Does it really work?
It remains an urban legend. It remains, okay, medically speaking,
yes,
there's no evidence to support, but by observation, it seems to work. Yeah. So I have to be very careful. I have to actually, I have to be a doctor, and I also have to be a man at the same time. As a doctor, there's no evidence to support anything about pineapple juice. Okay. But if I can argue from a medical perspective, pineapple juice is slightly acidic, which matches the pH of the vagina. Okay. That means it enhances the way the vagina is naturally. Yes. It enhances the secretions, it enhances the smell, the taste. Okay. Yeah. So there might be some evidence to support that claim. Yes. But generally, following a good diet of natural organic foods, yes, a proper hydration, yes, hygiene, yeah, cleaning the area, cleaning your underwear, following good lifestyle practices on hygiene and lifestyle will ensure an overall good effect on the vagina, on sex as a whole. Yeah. So it's not just limited to pineapples. You cannot say just because I'm eating pineapples, I'm not supposed to clean my underwears. Yes. Or just because I'm drinking cranberry juice, yes, I'm not supposed to, to be mindful of my hygiene. Yes. Yeah. So it's a multidisciplinary issue which involves every aspect of your life. Yes. Yeah. So it's your diet. It's your diet. Check on your health. Yeah. It's keeping your undies clean. Yeah. It's not sharing yourself with too many people. And yeah, exercising. Yes. Yeah. It's a multifaceted approach to. Yeah. Okay. Thank you very much. As you've heard, like mostly when it comes to your reproductive health, it's up to you. It's your hygiene, it's your diet. Drink a lot of water also. It helps. Mm-hmm. Is that correct? Yeah, that's very okay. Yeah, very, very true. Because water is life. Yes. Yeah. Yes, so you've heard from the doctor himself. Check on your hygiene, check on your diet. If you have any other question dealing with not necessarily the female health reproductive system, but also to the males, you can ask the questions on our IG page, that is Athletes Bond KE, on the comment section, or you can contact the doctor himself directly from the number which will be on the description box. Yes. So thank you very much, Dr. Ndwiga. You're welcome. Thank you guys for watching our part 2 of sex, female reproductive health and contraception. Till next time, bye.